I came as soon as I could. Oh, my goodness, let me look at you. What happened? Uh-huh. Yeah, of course. Let me start cleaning you up a little bit. I'm gonna have to get the nurse to take a look at you. I am just training and I'm not allowed to really treat anyone. But what I can do is just register you and take some details so when the nurse comes we speed things along, okay? Alright, so let me just... I can try and make you more comfortable before she gets here. Oh, can I? Yeah. Oh my goodness. How did that happen? Yeah. Yeah, when the janitor told me. I know, it's empty in here, yes, because we're all at the Christmas party. Yeah, I'm the only one who's sober. Yeah, I know it's one of those nights, but I have called the nurse on duty, so she's gonna come, and she might call the doctor as well. Definitely, I mean, I've never seen anything quite like this before, so... How did you walk into it, or... Yeah, I can see that your eyes are a little bit affected, so... Let me put some eye drops in your eyes. Yeah, if you can just look. Okay. Oh, that's one. And blink for me. Is that better? Yeah. Let's do the other one. Okay. Okay. They're pretty irritated. Yeah. Let's see. I just have these eyelid wipes, and I'm just going to quickly take out some of the debris around your eye area. I can see there's needles and some pieces of pine cone. Yeah. So did you walk into it? Yeah, I know, I'm sorry, I already asked, but... Okay, so, just stay still, okay? I know, I'll be gentle. Okay, so... Yeah. So you were decorating the tree, and then... Okay. And you were the tallest person at home, so you were the only one who could do it? Okay, just close your eye. I'm just gonna go over your eyelid, okay? Okay, so you tried to put the star right at the top, huh? And then it just tipped over? Hi. How's your other eye? Yeah, I can do that also. Let me get a fresh piece. Just close your eye again. Oh. Yeah, no wonder you don't remember much. It sounds like a really traumatic Christmas event. Was anyone with you? No, you're just trapped under the tree all alone? Oh, that's so sad. Okay. Well, we're gonna take really good care of you, okay? We're gonna make sure that you are the most needle-free, pinecone-free, and bobble-free person that's ever walked out this hospital. That's gonna be our Christmas gift to you. Oh, I'm sorry. Is that dramatic to look at? I can try to move this out of the way. Yeah, it won't go too far, but at least we get it out of the way so it doesn't remind you of the bad memories, okay? Alright. Okay, the other thing I can do is just really quickly apply some hydrocortisone cream. Yeah, I can see it must be very itchy. Okay. And after that, I'm just going to take some of your details, okay? And you'll be all set for the nurse. Yeah, let's just get your poor forehead and your cheek down here. My goodness me. This is not what you had in mind for a Christmas surprise. You're very brave to have taken on that big tree all by yourself. Okay, how does that feel? In your nose? Okay, sure. Just look up for me, okay? Just put your chin up. I'm just gonna stick it in there. sneeze. Go ahead. Bless you. Okay, let's go again. Alright. Better? Yeah, I can get you a tissue. 1 second. It's totally okay. There you go. Yeah, no, take it. Don't worry. Yeah. Alright, so let me get my chart here and let's see what information we might need from you from the doctor. Okay, so tell me your name, please. Okay, and your date of birth. 7. What's your contact number, phone number, in case we do need to reach you? And I definitely need an emergency contact because, you know, you're prone to accidents. And what's the relationship? Oh. And I do need an address. Okay. And a phone number as well. Same number. Okay. Alright, so tell me, are you allergic to anything? Okay, luckily not pine. Okay. And augmentin. Yeah, it's a type of penicillin. That's fine. That'll be really useful to know for the nurse. And latex. Okay, that's fine. Our hospital does stock non-latex gloves, but it's very good. He told me I'm going to underline that. Yeah, very important. Alright, so tell me, have you had any serious medical procedures in the last 6 months to a year? So anything like operations, blood transfusions, or any serious tests? No. Great. Well, let's hope this is your last visit for a very long time. My goodness, you're going to spend some time in here. Okay. And do you have any anxieties related to being in a hospital? Any kind of fears or concerns that we can help you with? Okay, needles, sure. No, it's very common. A lot of people that come here have that. Yeah, we can accommodate for it. Don't worry. Okay. Now I'm going to take a bit of a family history, alright? So just bear with me. It may take a few minutes, but I mean, you're clearly not going anywhere, so. Yeah, oh, by the way, did you want a glass of water? He already gave you one. Oh, our janitor is a sweetheart. We should have totally invited him to the party, but, you know, he drinks too much. Okay, on that note, do you consume any alcohol? Okay, how many units a week? Just a glass of wine with dinner? Okay, good. And how about tobacco? Do you use any tobacco? Either chewing or smoking? E-cigarettes? Oh, sweetheart, they're just as bad for you. But I don't judge, you know, I smoke sometime myself. Not tobacco, if you know what I mean, but just keep that between us. Okay, so on your close relative side, so either your mother or father's side or your grandparents, do you have any of the following? Just, I'm going to read a bunch of different conditions, okay? It's just a normal questionnaire. Epilepsy, any kind of cancer. It is sad, isn't it? Yeah. Diabetes. Okay, whose side? Okay, and how long? Okay, so it developed quite late. And she's still alive? Wonderful, good for her. Brilliant. Okay, Any history of heart disease? Yeah, both sides. Well, okay. And have either of them had any treatments or surgeries for it? Yeah, 2 bypass surgeries. Okay. All right. How about blood pressure, either high or low? Any abnormalities? You do. Low. And when does that tend to happen? Stress, so no wonder you're dizzy. Okay. I'll make sure that you get a blood pressure test today. Okay. All right. And do you have any issues with sleeping? And is that issues falling asleep, staying asleep, or waking up? Okay. And what do you do for that? ASMR? No, I haven't heard of it. Okay. That sounds really strange. Whatever floats your boat. Okay. Alright. And how about any mental illness or any concerns related to your mental health, other than the fact that you watch strangers on the internet pretend to care about you? Okay. No, I'm not judging. Good, nothing. That's excellent. I wouldn't judge anyway because I myself, sometimes really have trouble. But I probably shouldn't tell you about that. Last time I talked to a patient about my own problems, I got this really bad review from my supervisor. Apparently, it can make the patient feel as though they are not the focal center of attention and that I'm directing the attention at myself. And, when there might be in pain or... Okay. Right. So, this is the main part of the questionnaire today. What I'd like you to tell me is just a few more details about your reason for coming in. So you had an accident with your Christmas tree that fell on you. And exactly how long ago was that? Okay, so you came straight away. That's very good. That means we can take care of any kind of, wounds or scrapes that you have and make sure you don't get an infection. We'll probably evaluate you for a tetanus shot. When was your last one? 2 years ago. Okay. What happened then? Just a trip. Alright, no problem. Yeah, of course. I can have a look at it. Just an itch there. There's a tiny bit of pine cone. Let me just come in and get it. There we go. Better? Yeah, well, I'm just gonna have to wait for the nurse to take care of you. Okay. Yeah. Now, do you take any prescription medication at all? Yeah, and do you have enough of a supply with you? Okay, we can get you some. That's okay. It's a hospital, so if you're gonna forget your meds, it's a good place to go. Yeah. Alright. And tell me one more thing. When you were a child, did you have chickenpox? And were you vaccinated for it? What do you mean it doesn't make sense? Look, I know you're in shock. Just answer my questions. Trust me, I know what I'm doing. I've been in training for like 2 weeks. Yeah. Well, how long? Look, I'm not here to argue with you. Look at you, poor thing. You're in pain. Let's take care of this so we can get it over with. Right. Okay, so tell me, what other childhood ailments did you have? You're born with yellow fever. And if you had any other issues with your liver since then? No. Excellent. Okay. Let me have a look and see what other forms we need to fill out. Okay. Alright, I'm going to read out a few conditions and you just let me know if you've ever been diagnosed with them, okay? Allergic rhinitis. Yeah, okay. Anxiety. Arthritis. No, good. Asthma. And is that resolved? No. Okay, do you carry an inhaler? And you have it with you, great. Chlamydia, dementia, depression, diabetes, elevated cholesterol, epilepsy or seizures, gallstones, genital warts, it is the season, glaucoma, gout, heart attack or heart disease. I know we talked about your family. What about yourself? Okay. Hepatitis? No. Good. And irritable bowel syndrome? IBS? No. Migraines? Yeah. Reflux? That's when you get heartburn from acid reflux. You do suffer from heartburn, but you're not sure. Okay, I'll just let our nurse know. Syphilis? It's old school, right? Good. Tuberculosis? No. And ulcers? You're not sure. Okay. Are you currently under the care of any physician? Yeah? Wonderful. What's the name of your doctor? John Masters. And do you have an address or a hospital we can contact? Okay. Memorial. Alright. And what type of work do you do? Oh. Okay. Seasonal interior decorator. That explains a lot. Do you wear glasses or contact lenses? You do wear contact lenses. Okay. When was the last time you had your eyesight checked? 4 years ago. We might take care of that today. Do you use any illegal drugs or have you in the past? For example, when you were decorating said tree? Just kidding. No, good. Okay. Do you get regular aerobic exercise? No, neither do I. Have you ever had the pneumonia vaccine? Have you ever had a colonoscopy? Okay. So I'm just going to have to read some things to you, alright? And you just sit tight. Okay. So, thank you for coming in today. We may need to take your blood work, but since you haven't fasted, which means fasting for about 7 to 8 hours, we may need to schedule you back for another appointment if we do need blood work, okay? But some of the tests we can already do regardless of the fasting, alright? Okay. Now, I'm also going to give you a copy of this questionnaire that outlines your medical history and a review of your symptoms. And thank you so much for answering all of that, because your answers are very important. They'll ensure that your medical record with us reflects your medical history accurately. Since you're here for an emergency walk-in appointment, we can't have enough time to contact your doctor, so it's very good that you've given us all this information, so thank you. Now, do you have medical insurance at the moment? Yeah, and you have your insurance card with you? Okay. Brilliant. Now, I'm going to be able to go ahead and check your company's benefit administration and make sure your insurance plan covers this exam, and I can do that when you're being tested, okay? Sorry, my nose is running. I know it's a bit gross, but I mean, I've already examined you. I can't believe you're correcting my grammar with a pine cone sticking out of your head. Okay. Alright, so we're very happy that you've chosen our practice for your medical care, and we look forward to seeing you in the future. I don't know why it says that here, but, I'm required to say it. Okay, so if you could just sign at the bottom stating that you entrust me with all your medical records and your medical treatment, please. Brilliant, thank you. Okay, so what I'm going to do now is I will just take you to one of our exam rooms. There will be no Christmas trees there, I promise. And I'm going to sit you down and just make you comfortable. And then our nurse should be arriving any minute now, and the doctor will be arriving right after. So just make yourself comfortable and we'll take care of you from here, okay? Alright. And in the meantime, there will be a buzzer in your room, so if there's anything at all that's a concern or anything new that happens and you need my help, I can come in and take care of it for you. Okay? Lovely. So I'm just gonna go back and get drunk with my friends, but I do have my pager on me, so I'll hear you anytime, okay? Hopefully we won't have to cut anything off, yeah. Any questions? Great, okay, wonderful. So just follow me and we'll go into the exam